everyone. Kristin Walker here with Dr. Lisa Day. We're going to do our little after show about a couple of shows that we've done for the Meier Clinics Podcast. One where we just talked about knowing our truth, and also one about bipolar disorder, living with bipolar disorder. So Dr. Lisa Day, thanks for coming on video cam with me.
It's so fun seeing you in the reel.
I know. Yeah. It's just been our ears for quite a few months. So it's nice.
Yes,
it's nice to see a face.
Yeah, it's wonderful. It's wonderful.
So how was that for you? I mean, obviously, we did knowing your truth first, and for you, it's personal with bipolar disorder. So how was that for you to go? Because you had asked me, should we start with the one or start with the other? And the first thing I thought was, I want to ask her that on camera.
Oh, nice. Well, so I'll answer this, right? In a psychological way. No. So my truth is that I'm grateful for my journey with bipolar disorder. And I'm grateful that I am both a clinical psychologist and a family member, because the totality of that understanding has gifted me in so many ways to help folks who come into my office, and family members and friends and people in the community who struggle with it, things I would never have learned in a textbook. So my truth is, while I love speaking about knowing your truth, because I believe that's cornerstone to all functioning and cornerstone to knowing who we are and how we operate in this thing we call life. My truth is, with regard to talking about living with bipolar disorder, is that my journey has done nothing but enrich my ability and my compassion for my clients, friends, and family, and people in general who struggle with bipolar disorder.
That's what I kept hearing the whole time you were talking about it on our podcast. I thought, the level of understanding that she has as a clinician is overflowing, which is fantastic. And that's the level of compassion that mental health professionals need to have in order to treat someone who's struggling with this, and also help the family that is trying to support this person. So while it's you going through exactly what these families come in and sit in front of you about, that's only enhanced your ability to be such a great source of support and a life-changing source of support for these people.
Absolutely. And it's interesting because I use the word compassion, but I would even take it a step deeper. So we all can hear, and we know that tiramisu is this delightful chocolate delicacy of a dessert. But until we taste it and then even try to make it, we don't understand it at that deeper level. And so the neat thing about walking this journey with my daughter is that I know it, I feel it, I can taste it. And, I know that in our own journey, when we went to Seroquel, as you mentioned, with a friend of yours, I never, ever would have thought as a clinician, Seroquel, an antipsychotic. And yet it has been priceless in the stability of my daughter's life. And so the truth in my heart is that navigating that journey, in my opinion, is a gift from God. I'm able to understand it, work with it at a different level. Not to say that I'm immune from also needing the support that we talk about. I talked about the need for self-care and being able to ask for help and educating ourselves, that working through all of that, I truly understand the richness, the nectar, if you will, of doing those things in order to then be able to not only live with, but also support your loved ones.
I love that, because you always use that word nectar, and I don't know anyone else, and I know a lot of people. I don't know anyone else that uses that word. And so I'm like, I say this with our wonderful editor, Joe, who edits all of our shows on the Meier Clinics Podcast and a lot of our other podcasts. I'll say, yep, it's a nectar show.
A nectar show. Well, and even when I've done a number of shows, and certainly one of the things that I've shared with you, Kristin, is that I won't, and I say this with every one of my clients, I won't teach you anything I don't personally practice myself on a regular basis. And so when I say nectar, I think of that juicy, peach, or, but I think of it I hold it to my heart that in its purest sense, these things work. And I know it's steadfast and true. And that I also know, and I have goosebumps as I say this, that it's a practice. It's not an arrival state. It's not a tooth extraction. This whole concept of healing and growth, and the things that we do, and the podcast that we do to make these things known to the broad masses, it works. It's real. And it's an art, a practice, a path. And so the nectar for me is that I believe in it, from the inside out.
Absolutely. And what we can do, what we can do as a community out there is understand these things. I think about this, when I go and I was just at a conference about autism, and I don't have autism myself, and I'm here at this conference, and you know what? It only benefited my life in order to sit and know all about this so that I have that level of compassion. So it's the same thing with bipolar disorder or any kind of a mental health struggle, mental health challenge. Knowing about it lends itself to you being a more compassionate person. So you're not so quick to judge when you see something going on in a restaurant or in somebody's life, or as you said on the show, someone running down the street and, you're dealing with a horrific incident. Not rushing to judge comes from educating yourself about all types of different things, including what we just talked about on the show.
Well, and with the stigma, of mental illness, and yet it's is it epidemic? Finally, as a culture, we're coming to the realization of how many folks and how many of us struggle with challenges in that arena. We're seeing it everywhere. We have coaches and therapists and your wonderful podcast, to bring it into the public. But we understand that I completely lost my thought. I have to edit that part.
No, for real.
Oh goodness!
Let's just talk about
the truth is
women. Yes, let's just talk about how many times during a week in our busy lives, with you being a clinical psychologist, also a registered nurse, running a practice, being a mother, having a daughter that struggles with bipolar disorder, all the things I do, running this network of podcasts, all of whatever, all that is, and how many times during the week do we go, yeah, okay, the thought's gone. I'm sorry, it just disappeared.
Well, I like to call that, my friend, a mental pause. It's a mental pause, and it has nothing to do with my age.
That's right. It happens all the time. I'll sit there and I'll go, yeah, nope.
But I got that really quick. So before it floats out again, I'm going to share that thought. Okay, I'm holding on real tight. So what I say, especially with stigma, of mental illness and the various challenges that people have, that I say in general, people judge that which they fear.
Yes.
And if they don't understand, they're going to judge. And so, one of the things I challenge myself to on a regular basis, and certainly anybody I work with, out of the gate, I say, I challenge you to abandon all judgment and all criticism. But what I find in mental illness is that people judge that which they fear. And one of the things that you and I hear all the time, I heard it just last week, it relates to when people take their life. And you hear this, how could they be so selfish? And bad word, bad word, bad word. That person wasn't thinking about anybody else, and all kinds of judgment and criticism. And I always say, you have no idea.
Yes,
you have no idea the magnitude of pain that mental illness can cause. And with the concept of suicide, the more we can reduce the stigmas and the more we can educate people on treatments, on medication treatment of bipolar disorder, of healing with PTSD, of dealing with growing up with narcissistic mothers, of developing boundaries, the greater we're going to be able to equip people with tools to navigate that pain.
Absolutely. Absolutely. And let's leave this on this note. It's a little shallow, but it's okay. You can be shallow and talk about mental health struggles. I always look at, I'm in this bubble, as you are, of mental health. This is what we eat, breathe, and sleep. It's what we talk about. If I go to a dinner party and people are talking about design, I'm going to talk about, hey, I just interviewed someone about Munchausen syndrome.
Nice.
And everyone goes, But I see that happening in society outside of the bubble that we're in. I see that happening less and less. And the example I got this morning, as I was preparing to come on and do these shows with you today, was I was at my nail salon. And that's like the barber shop for men. The nail salon, that's where you just get every kind of person. Every bubble of society is going to pass through that space. And today, as I was getting a pedicure, I ended up saying, listen, I have to be out of here because I'm going to be recording with Dr. Lisa Day. We're doing a podcast. And he said, oh, well, what's that about? And I had a moment of, do I really want to go into saying that it's about mental health and watch whoever's in the chairs next to me or whatever get uncomfortable? I don't feel ashamed about it at all, but I just thought, do I want to? Just say it's about widget making, whatever. But I didn't. I said, well, it's about mental health. And the best thing ever conversation got started with the people next to me, with the person doing my toes. Oh yeah, we all struggle. Yeah, anxiety. I don't know why there is such a stigma about it. And I thought, oh my gosh, because 2 years ago I did a show where I said, oh, I brought this up at my nail salon, and crickets and discomfort and moving away chairs from where I'm sitting. So, and I live in the middle of the country. Okay. So the fact that here in the middle of, in this little itty bitty town, that was the level of understanding and the type of conversation that was had at the barbershop, nail salon, whatever. That's pretty good. That is pretty good. That says a lot about where our society is going in terms of our understanding.
Well, it's powerful. And I'll just say this, and I know you may want to wind down, but I haven't checked the statistics recently, but I know that it was probably 2 years ago, the number one prescribed medication of all times is Prozac. And, that at that time it was met with, oh, people get upset and they just take a Prozac. And I think that what we're seeing as shift is the reason it's one of the most popular or most commonly prescribed medication is because it's an epidemic. It's an epidemic.
Exactly. And end scene. No, I'm kidding. That was perfect. So listeners, YouTubers, please subscribe, follow us on the Meier Clinics YouTube channel, and listen to our podcasts on Mental Health News Radio Network. You can go to iTunes, Stitcher, 70 different outlets. You can also see them on Binge Networks TV. Just type in MEIER Clinics, and all these great shows that we do with Dr. Lisa Day, Dr. Paul Meier, many, many other people. They're all listed there, and you can tune in. And, there's nowhere I can yell to my Amazon Alexa, which she may start talking because I said her name, and tell her to play the Meier Clinics podcast, and boom. Out you'll hear lovely Lisa Day's wisdom. So thanks for tuning in and visiting us.
Thank you so much, Kristin.